Hi, this is Dr. Rod with 17th Street Chiropractic one more time here, and today I'd like to talk to you a little bit about something that usually gets a really bad rap, which is inflammation. Why it is important to have it, why you want it to happen in your body, and why you want to let it run its course. As long as it's not a lot of inflammation, why it is actually a good thing to happen to your body. So first, let's talk a little bit about what inflammation actually is and how you can recognize it. So inflammation has 4 signs that you should look for whenever you're trying to recognize that that area is inflamed. First one is redness. Second one is the tissue swells up. The third one is pain. And the fourth one is heat. Okay. Usually when you have those 4 signs, that tissue is inflamed. So what is inflammation? Inflammation is a normal response of your body to injury or foreign invasion of your body of fungus, bacteria, or viruses. So any pathogen that got into your body will create inflammation to fight that. Okay, and that's why inflammation is important and why you want to have it in your body. Most of the time, inflammation get a bad reputation. Once you see that a tissue is inflamed, you want to get rid of it right away, right? Because it's painful, it's uncomfortable, and it doesn't look good because it swells up, okay? Even when we have fever, which is a kind of a systemic inflammation of your whole body, first thing we do is take something to kill the fever, okay? That's not a good thing, okay? Because as I said before, that's a normal reaction of the body to actually fight off the infection or the damage that you caused to your body. That's your healing process to your body. So healing the inflammation right away is not the answer. It's not the right thing to do. Okay. Now there is a time that inflammation becomes too much and becomes actually damaging to your body, and I'll talk to about that in just a little bit. But let's talk about focus on how inflammation is actually good. So what happens to your body? Let's say you have some damage to your body, you got hit, and then you have scrapes at the same time. So you have damage to the tissue and you have some bacteria in there and your body's trying to fight it off. Okay, so the tissue gets inflamed. So the first thing that happens is your body increases the blood flow to the area. Okay, so that's why it becomes red. The area becomes really red because there's more blood going to that area. And the reason for that is, one, to bring more macrophages, with our cells that come and eat all the dead tissue and the tissue that is just shouldn't be there, like pieces of dirt and things like that. So it comes and eats that. So the body increases the blood flow to that area to actually eat all of that. And the second thing, it brings a lot more of T cells and immune system cells to actually kill all the bacteria and viruses and all that. So you want increased blood flow to the area to fight that off. But at the same time, because you have increased blood flow, you have also increased fluids in their area because you have more blood going to the area. So you have the swelling and the swollen tissue in the area as well. So those are the 2 first things that happen. Third one is heat. Your body increases the heat temperature of the area of your whole body in case of the fever because a lot of pathogens cannot withstand a higher temperature. Your body can, but the pathogens can't. So that will actually kill off some of the bacteria. Okay, and the last one is pain, and pain unfortunately is a side effect to actually having inflammation. It doesn't really gives any purpose other than tells your body to stay away from that area because it's damaged. So you don't want to put any more, cause any more damage or put any more pressure in there. So it kind of tells your body to for you to stay away from that area. So that's what happens during inflammation. Okay, it's your body healing itself. So you want that. You don't want to take an anti-inflammatory just because you have a little bit of inflammation or something to reduce your pain, just because, I'm sorry, not your pain, but your fever, just because you have a little bit of a fever going on. If you let it run its course and do its thing, it will help you to reduce the amount of time that the area needs to heal or even heal properly. Sometimes what happens, we talked a little bit about this during our cortisone shot, video piece that whenever we have some damage to the disc, people usually take cortisone shots, or to any joint really, take cortisone shots to kill the inflammation. And we'll kill the inflammation right away and get rid of the pain, as we talked about, but it will also kill the healing process, so that area won't heal and you have more problems in the future. So it's best to let it run its course and let the body fight everything that's going on in there by killing the bacteria and eating off all those foreign pieces of dirt and pieces of cartilage and bone or skin that are just dead, they're just floating over there. Okay. Now there is a time that inflammation becomes too much. Okay, if you have a really high fever, or if you have chronic inflammation to your body, that's not good. Okay, a really high fever actually will cause not only to start killing the bacteria and the viruses and all those bad things in your body, but it's actually going to start affecting your own cells. So you don't want that. If the inflammation is too much or your fever is too much, you want to bring it down. Okay, that's not healthy to your body. So that's the time when an anti-inflammatory or fever reducer or something like that is actually good. And the second thing is chronic inflammation to your body. If the inflammation is there constantly, that's not also good, because the swelling of the tissue can actually cause a lot of damage, actually break other tissues in the body, so you don't want that. And as I said, the macrophages, they will start eating your own organism, your own body, if they have too many, and that will cause more damage as well. Okay, and it will actually diminish your immune system and capability of fighting other infections and other problems, because it's constantly producing T cells and other cells to fight off organisms that are really actually not there. Okay, and so you don't want that. Chronic inflammation usually is caused by inflammatory diet or behavior like smoking and drinking in excess, or eating foods like deep fried foods and a lot of sugars and refined carbohydrates. So you want to stay away from those. Okay. Other than that, of course, always take care of your wounds, and you want to properly take care of the area and put some antibiotics, if that's the case, if you need it on the area, like some antibiotics lotion or creams to kill it, help kill it, and help your body to fight off the infection. But you don't want to altogether kill the inflammation process, because it's actually there to help you. So I hope this has been helpful. Everyone have a wonderful day. Again, this is Dr. Rod for 17th Street Chiropractic. Thank you.